practiced in South Dakota,
Oh,
for about 32 years, just as a general dentist, kind of private practice for the most part. And and then about 6 years ago, I came back and started teaching here after I retired from practice. So anyway, and then what I was going to say is that that third PowerPoint is one that I just put together 2 or 3 years ago. It was after the students did a mock board exam here, and I kind of looked at, kind of some of the mistakes and whatever they made, and just pointed out, gave them some helpful tips, like, is it okay to, which is better, to under reduce or maybe over reduce, and just kind of some little things like that, so that, at least when you're in there working on it, you have an idea of where you can maybe fudge a little bit and where you can't. So, but anyway, I'm going to do the share screen thing and bring up, this is the first one that I'm going to bring up, is one that, if you can see it here, one that Mark put together, Dr. Edwards put together here. So, okay, I'll do this and we'll just go through it. And again, like I say, if you have any questions about this, just be sure.
then one question is,
Mhm.
I'm not, because I never, I didn't go to the dental school that they use as the mannequin, and I'm
Mhm.
not sure a lot of time which burrs to use
Okay.
for the preparation. Will you be going through some of the burrs to use? Because there's no place I can find the burrs to use for each of the preparation for
Right.
the occlusal and the axial, the preparation.
Okay. I don't have any of that. I don't think in any of these PowerPoints, but
Oh, that's okay.
I, definitely when we're in Topeka, we'll go ahead and look at the burrs and stuff, because
That'll be great.
they'll have those there. I think they have a pretty good variety, don't they, Mark?
Yeah, we do.
Yeah. So, and we can kind of point out the ones I think that would work the best for you there. Some of the ones that you probably would want are something that's kind of a barrel shaped, with probably a tapered end on it. And then you want probably a flat end tapering burr too. So I think those would probably be the two of the main ones that you'd use. Again, we'll kind of look at the burrs and stuff maybe when we're in Topeka then. So, but I don't have anything on the
Oh,
burrs
okay.
today in either of these PowerPoints. This is more or less just going over some of the criteria, I would say. So, but anyway, and again, like you say, this is something that Mark put together here. We're just going to kind of look at it, and in this slide here, what we're looking at is, when you evaluate your prep work with your matrix, make sure that you get the matrix seated completely, because that really does make a big deal. You can see over here where the putty matrix actually contacts all the tissue and everything. So that's what we want. So that's the main gist of this. And again, what this slide is talking about is when you make a reduction, say like on this molar tooth, you can see how that's, you pretty much have a pretty even reduction all the way around. Look inside kind of far away, like on this one here, they're looking kind of toward that distal marginal ridge. Make sure that distal marginal ridge isn't touching the putty down in there too. So what they're trying to say here is kind of look all the way through the matrix and make sure that the reduction is kind of even all the way around. Does that make sense to you at all? Or
yes,
because you can have your ideal, your 1.5 millimeters like right in here, but way in the back here, that putty matrix may be touching part of the prep or the tooth that hasn't been reduced very much. So anyway, that's the point of that. Here, this is, when you're evaluating basically your line angles here, we don't want you using a pencil to draw on the preps at all, but definitely use the tip of the probe. You can go all the way around and just evaluate for your undercuts that way. I'm sure you know how to do that, so it's not any big news to you. We're going to go through a few other criteria here. And of course here, what we want is nice, smooth cervical margin. You can see that right here. The path of insertion here, or the line of draw, the prep we want the prep to be upright. Every once in a while we see, especially with this prep, this is number 5, that people can tend to lean it toward the mesial. So, and in this case, it's pretty much upright. The margin, this margin here, from here to the gingival tissue, should be about a 0.5 millimeter. So that's the one thing I think, when we'll look at your preps, that, you're probably trying to put that margin underneath the tissue. And, this tissue isn't realistic. That's what you want to do in real life, of course. But for our testing purposes, you want to keep that margin just a 0.5 millimeter above. So, and here is, again, the cervical margin width you want. They have a millimeter there, which is, acceptable. And again, here, that's okay, it's a millimeter, but a millimeter above the tissue is acceptable, but 0.5 millimeter is actually the ideal width. So again, margin definition here, what we're showing here is that the margin, it's continuous, but it's kind of slightly rough here. So, and then the ideal is sat, where this would be all kind of nice and smooth through here. Again, this isn't going to probably fail you, but you're probably getting down into more of the acceptable, possibly the subcategory when you get kind of rough like this. Line of draw, what we're talking about here, usually what I tell my students is that you want this prep to line up. There's kind of like a eminence above here. So you want that to line up, and again, like I say, the tendency on especially this tooth number 5 is for the whole prep to kind of lean toward the mesial. We want it pretty much upright. So, and again, this isn't, if it's like this, it's not going to fail you. It falls probably into the acceptable category. So. Okay, moving on. Again, walls are nice and smooth, and that's what I saw, I think, on a lot of your preps, is that you really had nice smooth walls. I think good hand skills. We don't want this over tapered. And again, there's two categories that we talk about. One is the line of draw, which is the prep being upright or tilted, and then the taper is actually this part right here, these two lines. Is the prep fairly parallel, or how much taper does it have? We know that, and for our criteria, between the 6 and 16 degrees actually falls into the ideal category. So. And then this is the taper guide that we use when we're grading this. I know you probably aren't going to get to use this during the real exam. We could let you look at it, I think, when you're practicing or whatever. So, okay. Any questions so far? Or?
Oh, no, I think this is very helpful, because
Okay.
no one ever showed me this before. This is really good. That's why I need help.
Yeah.
When
That's
this, you kind of show me, I need to look at the taper guy. I don't know what, the ideal, the taper,
yeah.
yeah.
Well, perfect. I'm glad to hear at least what we've gotten into so far is helping a little bit. So
Yeah.
now in this slide here, again, we're showing part of that number 5 prep. Reduction of the occlusal, needs to be 1.5 millimeters, and that, of course, that's ideal. And again, the facial 1.5 millimeters reduction. Usually that will taper off to where it's probably reduced down in this area where we're looking at kind of this shoulder. On this prep, you can do either a shoulder or kind of a chamfer margin on it. So, but you probably will be reduced about 1 millimeter here and gradually go up to where it's about 1.5 millimeters reduction up through here. So, and again, you want to maintain the occlusal anatomy. You don't have to get real detailed about that. There's really only one grading category for occlusal anatomy, and it's either there or it isn't. So, I wouldn't get too hung up on trying to make, exact details for occlusal anatomy prep. Does that make sense to you? I mean, it's either sat or it's sub, and in order to get a sub, you have to make the whole thing flat. And of course, if you do that, there's going to be other problems with, you know, reduction and things like that anyway. So, okay. And undercut, this is acceptable here. We, you know, the prep is maybe a little rough, but there's no undercut and that we can see here. Now, if you happen to leave these burn marks or whatever on there, these are plastic teeth. Don't worry about that. There's no downgrade for burn marks or anything like that. I don't think you want to wind up with a lot of them or anything like that, but some people get real concerned about it. Don't worry about that.
Oh, okay.
Okay. Okay, and again, we're talking about our taper, and of course there's that taper guide. Anything over 16 degrees, here they're saying this is 20, so that would fall into the acceptable category. To get way down into the def category, you got to really make a teepee out of it, and we'll see a picture of that here in just a little bit. I don't know if I've ever seen that, so usually it's, you know, like this is pretty acceptable. So I've never seen anybody that, I mean, there's some exceptions. Anybody fail the exam because of, you know, over tapering. So, and here's
Oh.
here's an example of something that's more than 30 degrees. So, and well, I mean, you know that that's not going to fly, of course. So, and then occlusal reduction. And here, this is under reduced. You can see when they put this putty matrix back on that these cusps were supposedly they reduced are less than a 0.5 millimeter, or they're probably almost touching. Of course, then that falls down into this def category here. So the satisfactory, of course, is that 1.5 millimeters that we're talking about. Acceptable. If you go up to 2 millimeters, no problem. It's still acceptable passing. When you get down into here where you're, you know, less than that 1.5 millimeters, or you're getting more up into the 2.5 millimeter reduction, then you're getting down into the subcategory. So any questions about that? I know, you know, in real life, you want to have these preps, the occlusal parts of them probably reduced even sometimes at 2.5 millimeters, but for the sake of the exam, we kind of have to, you know, we use the 1.5 millimeters as the ideal. So it's probably not true to real life. Real life, you know, you want to have plenty of reduction. Here, of course, we need to have some criteria for the occlusal reduction, and so that's why it's 1.5 millimeters. So. And again, you can see this one's really over reduced more than the 1.5 millimeters. So this falls into the sub or the deficient category, excuse me. And then this one is, you know, basically they're touching, so there's not enough reduction, probably less than a 0.5 millimeter. So again, that would fall into this deficient category. Okay, here, you know, like we were saying, we want 1.5 millimeters reduction here. Here they're saying that's 1 millimeter, which, you know, that's still okay, falls into this acceptable category. So anywhere from 1 millimeter, I mean, you get to play with at least 1 millimeter here. What, you know, 1.5 is the ideal. If you get 1, you're good. If you get all the way, if you don't go any greater than 2, you're still good on that too. So. And of course, here's the idea. The thing that I tell my students is that, you know, what they often do is they'll reduce this, but then they don't get enough reduction on these secondary planes. So, you know, what happens is that this cusp is still way up, and it's, you know, they don't get enough reduction through there. So, and I noticed on your preps, you did really good job with these secondary planes. So of course that's, you know, you're experienced practitioner, so I can understand where, you know, you did a good job with the students that are just starting out. Sometimes they don't get this 1.5 millimeters all the way around. And of course, here's a slide that shows, I call them secondary planes here, where they just don't have enough reduction in that area. Of course, they do on the buccal, lingual of these, buccal and lingual, but probably just not enough in some of these other areas here. Again, you can see here, the prep is almost touching the putty matrix there. Internal line angles, we want these cusp tips to be rounded, nothing sharp. And again, this is a good example of, you know, everything's pretty well rounded, no sharp line angles anywhere. This one's not so good. Lots of sharp line angles. The whole prep is kind of rough. Has some other issues too, but as far as the line angles go, it's we'd have to, that would fall down into the substandard category. Okay. Occlusal anatomy maintained. Again, these are just fine. You don't have to get real detailed with the general occlusal anatomy. Here's a photo of a lion. So, okay, and we're going to get in some other categories here. Go through those. This is on the tooth number 3. Again, you can see the nice smooth, it's reduced about that. Well, we have that a 1/2 millimeter margin from the gingival tissue up to the edge of the prep. This looks like it's all in line. It's the path of insertions, within that 10 degrees of the long axis of the tooth there. And of course, this is all nice and very smooth. So here we go. They say that this cervical margin here is 1 millimeter, and we're looking at from there to there as being 1 millimeter. Over here, 1/2 millimeter, which is from there to there. So this is okay, acceptable if it's still at 1 millimeter. This is the ideal, of course, is that 1/2 millimeter from the tissue to the prep margin. So here we're looking at the definition of the margin, how smooth or how we're looking at the continuity. Here we're kind of, I don't know if you can see it very well in yours, but it's kind of little chinks and stuff there. It's over here, it looks like it's pretty nice and smooth, but when we get to this area, it's a little rough. This is probably might be graded a little hard here as substandard. Some people call this acceptable, some might be substandard. Again, I don't think this is something that's going to fail you at all, but I probably would try and make sure that you keep your margins as smooth as you can there. So, okay. This is that line of draw that I was talking about, where you want these preps to be upright. And here, this molar prep on number 3, they have it leaning toward the mesial there. And I can understand how that can happen. You're kind of trying to keep away from damaging this tooth over here, and this axial wall gets leaned in, to the mesial quite a bit. And so I can understand how it can happen, but it's just one of those things that when you break the contact over here, you just got to be kind of careful not to lean that burr too much toward the mesial there. I don't see this very often, but it can happen. So here's more of an ideal line of draw. Again, that prep is pretty much, the whole thing is pretty much upright there. So, okay, some other criteria we're going to look at here. And again, reduction, 1.5 millimeter reduction on the occlusal, on the axial walls. Everything's nice and smooth. Taper, at least at this point, we don't have this side prepared, but it's probably going to be at that 6 to 16 degrees. All looks good here so far. Again, line angles, I don't know if it's could be a little bit sharp there, but for the most part, everything is rounded and fairly smooth through there. General occlusal anatomy is maintained. This is all you really need to do. In fact, this is probably really almost overdoing the occlusal anatomy. You don't have to, again, like I say, you don't have to get real detailed with it, but you have to pay attention, put your putty matrix on there and make sure that especially even back in here, that you have that 1.5 millimeter reduction. So it's just, just got to make sure that basically the general anatomy is maintained. No, you don't have to get into a lot of details. My students, they try and get into a lot of detail. I tell them, you don't have to. So here we're looking at the axial wall, the smoothness of those. Again, you can kind of see here with this close-up that there's little chinks in that. So, and again, the ideal would be to have that really nice and smooth through there. Again, this might be, and we're not looking at that criteria right now, but the criteria between the prep margin and the gingiva, that might be a couple millimeters or more. So again, we're not talking about that in this slide, but they probably would want this prep margin to be down more to about 1/2 millimeter from that tissue. Taper, again, this one here, it's not too bad on this molar. So, and this is that taper guide again that we were talking about. You want to stay probably in one of these two categories, the satisfactory or the acceptable category. So, and I think most people do for the most part. So again, you can see how the prep on this tooth almost like leans toward the mesial a little bit, and probably would want that a little more upright. Again, just kind of pointing some things out. This molar prep actually looks pretty good. It might be, again, leaned a little bit toward the mesial, but you know, like I say, with this eminence above on this tissue, I just kind of have my students line that up and make sure that the prep is kind of all in line with that.
So there's a tendency of leaning toward the mesial. Is it because of number 6?
I don't know if it's probably true, because number 6 kind of leans toward the mesial.
To the mesial.
Yeah. And, you know, without this tooth right there, it's almost pretty easy to over reduce. Well, maybe not either, but I think you're probably right when you say, you know, that number 6, it kind of leans toward the mesial. So
mesial.
Yeah. So you kind of have a tendency to follow that. But like what I tell my students is, look at this little eminence above there.
Eminence. Okay.
Yeah. You know, because if you line up the whole tooth, because apparently, you know, or supposedly that's going to be the tooth root up in there. So you just want the prep lined up with the root of the
I mean,
tooth.
that's really helpful to see it like this. Otherwise, people wouldn't know. Like, I wouldn't know. I mean, if you didn't show me like two lined up with, you know, the root,
right,
it might have a tendency to lean toward the mesial.
No, and that's why we're doing this, is to kind of give these little tips and pointers to you for that. I mean, it's what I do for my students. So, and it's it's good. And again, here's that 10 millimeters. You know, it's almost, they probably needed to prep that a little bit more, but it's not, you know, falls within the 6 to the 16 degrees that we want. So.
That's really helpful to know the 10 millimeter.
Yeah, you know, and again, I don't think I've seen a lot of people fail because of that, but it's just one of those things that if you can kind of keep it where it, you know, where it looks proper, I guess is maybe my way of saying it, you should be fine. So now in this slide here, what we're talking about is the margin here on like this tooth here. You want this margin kind of all the way around to be about 5 millimeters in width. So here they're maybe getting up more close to a millimeter. You can see the margin's a little bit wider, but usually on this tooth here, you want to have like a chamfer margin, just kind of a beveled margin. Again, you're using zirconia or metal or whatever here, and you know that type of margin certainly is fine because you're using a pretty strong material. Now when you get, and we'll be looking at it on the tooth number 9, the anterior prep, you want shoulder margins there because you're using probably an all porcelain material, and that doesn't really, an all porcelain material needs a shoulder margin for it. And we'll look at that here in a little bit too. So, but anyway, this looks good on this tooth right here, the margins when you look at it. And again, you know, as you go around, you kind of want that 0.5 millimeters, kind of a sloping kind of a chamfer margin on it. So, and again, your occlusal, your axial reduction, 1.5 millimeters, and make sure you're looking at it from all the different angles here. You know, with the students, they have a tendency to not do these, what I call secondary planes. And what happens is that they'll do a prep, and then the prep comes up and almost touches like red at this point. I've seen a lot of failures just because of that. So. And here we go, this preparation, I guess they're saying there's 2 millimeters worth of reduction there. Again, ideally we want about 1.5 millimeters there, but 2 millimeters is not going to fail you either if you wind up doing that. The thing is that look way to the back and make sure that like this distal marginal ridge is not touching your putty matrix way in the back there. Okay. Now, here's what I was talking about, where you don't get those secondary plane reductions, and they reduced here, made it all kind of almost nice and parallel, but they didn't get this part reduced. And of course, that's a failure, a def when that happens. And again, this prep here looks really nice. That 0.5 millimeter margin width all the way around. Everything is really nice and rounded, distinct. You have your distinct line angles, but they're all, not excessively sharp. This one here actually is not too bad. There's this little spot right in here where there is a little bit of sharpness, though. You can kind of see that. So, and again, that probably would only fall down. Well, let's see. They're saying internal line, they fall into the subcategory. So yeah, make sure you don't really want to be in the subcategory. You want to be either the SAT or the acceptable category. So, and again, I think they're calling this one not their tendency of being sharp. To me, these don't look too bad. Maybe right in this area could use a little bit of rounding too. So, but overall, this looks pretty good. This needs a little help there. So, any questions so far?
But you said that on the posterior teeth, like number 3 and 5, if you happen to do a shoulder, it's okay, or is it still acceptable, or chamfer?
I would do a chamfer on this molar tooth.
Chamfer on the molar.
Yeah, and actually it's acceptable to do a chamfer on the premolar too, because you're using zirconia there.
Okay.
But people will use a shoulder margin on the buccal, which I think is perfectly fine, probably more preferable too. On
the premolar.
Yeah, I wouldn't use don't use a shoulder margin on the molar.
I just wanted to get that distinction. Yeah. That's right.
But if you want to use a shoulder margin on the premolar, I think that's fine.
Okay.
In fact, the more ideal thing is kind of a shoulder margin on the buccal side. And then when you get to the lingual side, people use more of a chamfer margin.
Okay. There. So lingual on number 5. I just want to clarify that.
Yeah. Oh, that's good. Yep.
But you won't get hurt if you're using a shoulder on the premolar all the way around.
No.
Oh, okay.
By
the criteria that won't hurt you at all.
No.
Okay.
It won't hurt at all. So whatever, the most common thing that I see is a shoulder margin on the buccal and a chamfer on the lingual, but you can do a shoulder margin all the way around too.
Oh, okay.
And here we're talking about the occlusal anatomy, which we have done here. This is the only time that you're gonna, if the whole thing's just flat, it'll fall into the subcategory. It probably won't fail you on this, but the more ideal is to have some type of a, maintain some type of a occlusal anatomy. So don't do this, and I don't think you're going to. So, and here's the bridge factor. What we're looking at here is to make sure that everything all draws. I tell my students, make sure you can see all the line angles and all the axial walls from one point of view here. And again, this looks nice. You have this kind of a chamfer margin that's about 0.5 millimeter all the way around. Here it looks like they did a shoulder out.
Shoulder, yeah.
And maybe somewhat of a chamfer here. So that's the most common thing that I see. With the bridge factor, what I tell my students is that if the two preps don't draw, where I see the most common places is from this point to this point.
Okay.
Oftentimes there'll
distal lingual.
Yeah, the distal lingual of the number 3 to like the mesial buccal of number 5. It seems like that's kind of the hang up. Everything else looks like typically will draw. It's just, you'll get a little bit of an undercut, and typically it's right here. I think if, they tilted the camera a little bit more on this toward the mesial, this would all look okay. Right here, almost looks like there's some undercut there, but, we have you can see plenty of the axial wall on here. So it should all be good. You just want to make sure you see all the axial walls, all the line angles, especially, this line angle where in this area there, that you can run your periodontal probe around, and you can see the tip of the probe everywhere.
Okay, tip of the probe, okay.
Yeah. And here's an example of where there's not draw with the bridge factor. And of course, you can see, like I say, it's usually,
Oh, you can't see, yeah.
yeah, you
mesial-
can't see all the axial wall here. And, you know, besides the preps being a little rough and not real smooth, it's
Mhm.
usually from, like I say, from this angle to that angle or somewhere on the mesial where, you know, things don't draw very well. So
Yeah,
that's the typical thing that you'll see. So I just tell my students, don't, you know, just be aware of that, you know, for this bridge factor, make sure that you can see all your axial walls and line angles.
oh, yeah.
Pretty photo here of a sunset. Okay, now we're gonna get on to that tooth number 9, the all ceramic lithium disilicate ceramic prep. And again, this is pretty much standard. We want that margin to be 0.5 millimeter away from the simulated gingival tissue there. You know, this looks like we got it between a 6 and a 16 degree, you know, taper on that. So everything looks pretty upright. So everything looks good. Usually what we want here is we're going to want a shoulder margin on this kind of all the way around. And we'll get into that here a little bit later, why, you know, why we want to have that. So again, this looks pretty ideal here. We got a shoulder margin all the way around. You can see from the occlusal view or the incisal view that, you know, you have the shoulder all the way around. This may be getting a little, almost a little bit more on the wider side than what we want to see. Usually it's about 1 millimeter, and this is about 1 millimeter here. But you can go 1.5 millimeters and still not, and that's one of the things that you can take a little bit more off of this and still be okay. If you take less than 0.5 millimeter off, then it's a def. So in this case here, it's okay to go just a little bit more than not too much, than not enough, basically. So does that make sense to you? We'll look
Yeah.
at that a little bit more again too. So, and again, here's that line of draw on these preps. Oftentimes, I never see one of these tilted toward the mesial. It's always tilted toward the distal. And again, I think it's probably this tooth number 10 has that kind of a distal tilt to it. So just kind of watch out for that. So I don't see this very often, but if I do see something that's not, you know, the line of draw is not perfectly straight, it's usually tilted toward the distal. And again, here they're showing where the cervical margin, 0.5 millimeter from the simulated gingival tissue. So, and that's the ideal or the satisfactory. Again, you can go up to 1 millimeter and still be acceptable there too. Or you can go all the way down just to the gingival margin and it's still acceptable too. It's not ideal, but as long as you don't touch or bother the simulated gingival tissue, you're fine. So. Okay, here's one where the prep is right down to the gingival tissue. Again, this is acceptable. You don't really want to go too much farther than that because you start getting into trouble too. Here they've done okay because they haven't really messed with the simulated tissue at all. So, okay, so, and here we're talking about the margin definition. Everything's nice and smooth all the way around. Again, this is that prep that was prepped all the way down to the tissue level, which in, you know, probably in real life, that's what you want to do. For our purposes, we just want to keep that margin 0.5 millimeter above. I know that's not real life, but that's the way the exam is. So that makes sense to you. Again, kind of an ugly prep here. It's you kind of laugh at. I almost say it almost looks like a witch's hat or something like that. But the line angles are not smooth. We have what we call that J. It's that lip J prep where, you know, if you look at this, it looks like a little inverted J. You don't want this because a J prep is definitely a deficiency. It definitely will fail you. The other thing that we're going to talk about too is this sloping shoulder. That's another thing that you don't want. Basically, a sloping shoulder is kind of what you're doing probably more on the molar, but when you're doing this anterior prep, you want to have a shoulder margin on that. So, okay. And again, line of draw, this looks good. We're pretty much straight up and down. I think probably with both of these. Taper is a little, well, taper on this one looks pretty good. This one's a little bit too parallel. So again, line of draw, we want to be pretty much straight up and down with the root of the tooth there. This one, again, probably tilted a little bit toward the distal.
Yeah.
So, I mean, and it's not going to fail you, but, you know, if you tilt too much, then it falls into the acceptable category. Okay, some other preps here. Again, everything looks nice and smooth. You can see that nice smooth shoulder, you know, about 1 millimeter wide there. That's exactly what you want. This incisal reduction, you want it to be 2 millimeters. You can see over here, it's 2 millimeters. Cervical margin, 1 millimeter. We talked about that. This lingual wall height, which is from here to here, and you can kind of see it from there to there. We want that to be 1.5 millimeters. Okay. And if we get undercuts in this prep, you know, and we'll look at it from the incisal point of view, it's usually from here out onto the facial. So, okay, yeah, right here. If we have an undercut, it's usually from this point to this point. So, and again, this looks good. We have that shoulder margin, millimeter wide, all the way around. So, okay. These are fairly ideal preps here. Again, this one kind of maybe leans a little bit toward the distal, but that's not necessarily what we're looking at. We're looking at the axial wall smoothness and making sure there's not any undercut. And these look nice and smooth. The line angles are rounded. So at least in that category, the score sat. This is a little bit too parallel, this 5. Again, that 6 to 16 is where we want to be. So again, I had one of my fellow professors called this stovepipe. It was like too parallel. So you don't want to have things too parallel. I mean, if you do this, it'll fall into the acceptable category and it doesn't fail you, but you want to have a little bit more taper than what you're seeing here. Here we're getting a little too much taper. They're calling this 29 degrees. Again, if you get over 30 degrees, then that falls into the deaf category, the failure category. Here, this is just a sub. You really don't want this at all, though, either. So a little bit too much taper there. Okay, cervical margin width. Again, we talked about that 1 millimeter cervical margin width as being the ideal. You can go up to 1.5 millimeters and you're still within acceptable. The thing is that you don't want to exceed, you know, anywhere from 1.5 to 2 is you fall into the subcategory, and anywhere from 0.5 millimeter to 1 millimeter is again into the subcategory. So you want to be in this at least 1 millimeter to 1.5 millimeters. Okay. If you get to be more than 2 millimeters, again, that's a failure, or less than 0.5 millimeter, again, that gets, you know, down to the deaf category. So this millimeter to 1.5 millimeters right in here is where you want to be. And again, we talked about the incisal reduction. 2 millimeters is the ideal. Here, they're a little bit over 2 millimeters, which probably, you know, they'll fall into the acceptable category because of that. If you get over 3 or over, then you're, you know, into the deaf category again. Lingual reduction, ideally, 1 millimeter there. And this is how you measure that. That lingual wall height, which you talked about earlier, is from this point up to that point, which is that 1.5 millimeters that you want. Again, you can see this right through there. Looks like they have that millimeter wide shoulder margin there. Okay, here they're 0.5 millimeter, which the ideal, of course, is 1 millimeter reduction all the way around. So if it's 0.5 millimeter, it'll fall into that subcategory. So just make sure that this is all at least 1 millimeter of reduction there. And here's that 1.5 millimeters. Right there. Any questions about that?
No,
Okay.
it's just that measurement is a little bit stressful to me.
Yeah. Yep. So,
Just
but yeah,
had,
that's
just
the
had to make sure all that measurement is correct. I think.
yeah,
number
and that's
9
where, yeah, just kind of knowing, having to know all of that, all the measurements and stuff. And you can write some stuff down and take some notes in too, if you want, these different things. So you don't have to necessarily memorize all of these either. So I think that's okay, isn't it, Dr. Edwards?
Oh, yes. And yeah, Cindy,
Yeah.
if you, a suggestion would be that you would print off that candidate manual, and you can write on it. And what I would suggest is on all 3 preps, you would make a little diagram, and you could, have the ideal dimensions on those diagrams. Then you can use that when you work with Dr. Hattervig the day before you take the exam, but then you can take that into the exam with you.
Oh, really?
Yes.
Oh, okay.
Yep. And you can have it on a diagram. I mean, it's a good way to study, but then it would be a good way to kind of translate it and take it in and refer to it during the exam.
Oh, so I can take it into the exam.
Yes.
I didn't know that. So that's
Yeah, it's got to be within your manual, but there's spaces on those pages to draw diagrams on.
Oh, okay. Okay, that's why. Yeah, I wasn't sure.
Yeah, and just by drawing the diagrams and outlining them and putting in the measurements, I think that helps you remember those things better too.
Yeah,
So,
yeah.
and
No,
then
that
you
would be
can,
helpful. I didn't know if I
Yeah.
could bring stuff in to the exam and,
Yep.
trying to remember everything.
yeah, it's pretty hard to remember everything. I mean,
Yeah.
me grading students and grading credits exams, I kind of know all this by heart, but that's only because I've done it for so long, it seems like. So, but definitely, yeah, just, get something drawn up, print it out, whatever. You can take it into the exam with you, and then you just have that as a guide. So,
Yeah, that would be helpful because sometimes you forget by the time you get to number 9 or you prep it, you just kind
Yeah.
of forgot.
Yep.
Yep.
Yeah.
So again, this is a diagram showing that lingual wall height, 1.5 millimeters, just what we looked at. Here's with the putty matrix, the facial reduction on this tooth number 9. Ideally, it should be 1.5 millimeters. Here they have 1 millimeter, which falls into the acceptable category again, okay. But the ideal thing would be to reduce that just a little bit more. And what you want to do is you want to follow the contour of the tooth too. And here there's going to be that little bit of a curve to it from this point to this point. Again, where I see undercuts happen are from here to here. So you have to be a little cognizant about, you want this to be 1 millimeter wide right here, and this to be 1 millimeter wide right there. But sometimes make sure that, sometimes you have to slope this lingual wall in a little bit toward, basically toward the facial, away from the lingual or the palatal area there, to make sure that you don't have undercuts. So, because that's where I'll see people have an undercut, is from that to that there. So, okay. Line angles, round and smooth. Everything looks pretty round and smooth. Again, this one is probably a little over tapered. This looks pretty good here. The margin, the shoulder margin is probably a little wide on this. I think it's a little bit more than 1 millimeter, might be 1.5 millimeters. If it's only 1.5 millimeters, it's still acceptable, but you want to just shoot for that millimeter is the ideal. Again, adjacent tooth damage. You can see how they kind of took a slice off the adjacent central incisor there. We don't want that to happen. I think when I looked at your preps, you didn't really damage the other teeth. There was one, I think, like this where it did have a little bit, but for the most part, you did a nice job, I think, with that. So, but just be careful, you don't want to, this is definitely a failure, a critical deficient if you slice off that much of that tooth there. So. And again, another one where they, kind of did some damage to that tooth number 2. And yeah, there it goes. And I think that's it for this PowerPoint. Any questions at all with any of that?
It just like I said, I need to know like the more like, because in dental school, I mean, you go through the burrs. I need to kind of know the burr. I mean, the
Yeah.
process of cutting it, what's the efficient way? You know, this is really helpful of knowing the exact criteria,
Right.
you know, and cutting it, and the you know, I need to know the process of cutting. Of course, you know, you'll be showing me of how to cutting it. It will.
Yeah.
This is already really helpful, knowing
Okay.
the, you know, the 6 to 16 degrees and everything.
Knowing all that. And, you know, for the
Yeah.
most part, that's probably not what fails people, is the over tapering most of the time anyway. So, but yeah, knowing that, and like the 6 to 16 degrees, you know, for your
Because when
taper.
I was preparing, I can't find any. I mean, nobody here. I mean, nobody knows here of have ever cutting the mannequin teeth. And when I
Yeah,
look at the YouTube, nobody had, you know, had given any criteria. So
right, right.
so
So
I don't know the criteria
yeah.
on it.
So that's what we're doing here is
That's really important to me, so I know exactly.
yeah. Yeah, no, if you don't know the criteria, you're kind of almost lost in a way. So anyway, well, what I did here was I took some photos of the preps that you did, and we'll just kind of go over them. I mean, there's a lot of good things to some of them. There's some things where I think, you know, it kind of messed up, but it's because you didn't really know the criteria. And that's what we're looking at here today, is, you know, just helping you out with the criteria. So here, this was your lingual reduction, and I apologize for some of these photos. I just took them on my phone and
Oh
transferred
no,
them over.
it's great.
Yeah, I mean, some of them I had to take some of them 2 or 3 times to kind of get the clarity that I wanted. But again, here, this actually looks pretty good, you know. SAT millimeter reduction, here you had about 1.5 millimeters, and you probably didn't even really know the criteria at all. And I probably, you know, here probably needed to push this putty matrix down a little bit, and it probably would have been closer to 1. So really, this looks pretty good, I mean, on your prep. So this was the one where the SAT is 2 millimeters, and you can see there's 1, 2, and 3.
3.
And
Yeah.
that's where, you know, this kind of hurts you because you didn't know that this needed to be at 2. So in real life, this is probably great, you know, given the lab plenty of reduction to be able to put a crown on there, they love it. But for our criteria, this can't be 3, it has to be 2. So if that makes any sense to you. So, and again, here, this turned out a little blurry here. The thing that I liked about this is that you had kind of that, you're attempting to kind of make this round up here, which is good, because a lot of students they just prep this up, and then it gets to be within less than 1 millimeter reduction up here. So they don't round this over. You were doing that, you just had a little too much incisal reduction there. Here I pointed this out because I wanted you to maybe do a little bit more of a shoulder margin around through here. So, and probably what you might have had is a little bit of that sloping shoulder or kind of a chamfer, but we want to keep more of a shoulder on this. Then this is at tooth number 9. Does that make sense to you?
No, yeah.
Yeah. So, and for the most part here, you know, you had a nice shoulder coming around here, kind of lose it a little bit there. We got it back here, and then it kind of went subgingival there. So, but we want to keep that, you know, here you're above the tissue. It's just that you got a little bit below the tissue there, and that kind of messed you up too. So, and here, this is maybe the taper on this isn't bad, but we probably just needed to round off those incisal, or the little line angles on the incisal a little bit more there. So I like the way you had this nice and smooth though. You know, your axial walls were really nice there, nice and smooth. This probably could use a little bit of some rounding there. So
I think I think I got all confused on the shoulder chamfer and
yeah,
everything, because I wasn't sure. And then when I get more and more confused, I got a little bit really scared. And the
yeah,
more scared I didn't even know what to do. So I became very confused, of a little bit
yeah.
scared and afraid. So I got
Yeah,
didn't
it
know
can
how
happen,
to prep.
right? I mean, something doesn't go quite right, you get a little bit flustered and then kind of things go
Didn't,
all
pr-
back.
didn't know whether to prep shoulder shift, and then got
Yeah,
really scared and got a
yeah.
little forced.
No. But like I say, I see a lot of good things on this. There's just some little detail work that is needed to, like you say, it's easy to get flustered too. So it's one of those things that, if everything goes well, you usually can keep your composure and do well, but
Yeah.
things can kind of go south too, and then it all messes up, but still.
So now I can see that it's okay to prep. Now I know it's shoulder, chamfer, and
Yep,
shoulder. Now I'm clear on that. So
yep,
now, and I wasn't sure what is 0.51 millimeter. Now I get it. So now
yep.
that
Okay.
makes
Well, good.
sense.
Well, I mean, that's why we're doing this, is that to clarify all that stuff for you. So, and again,
Yeah. So
on-
that gets very confused because
yeah. And again, like I say, you think you had a good shoulder coming around here, and this is not bad. You don't want to have this less than a 0.5 millimeter. Otherwise, that's a that's a failure there. So, and here you're probably okay, and there you're probably okay. Here you're just kind of not quite, you didn't quite get the shoulder all the way, yeah, all the way around. And so, and even over here, we don't have a nice shoulder margin there. And of course, we have this kind of damage to the
yeah, because
simulated.
once you damage the tissue, then I don't want to cut it anymore. And then
Yeah,
so
yeah, like right in here, if you were to, once you got down that far, if you were to try and make a shoulder there,
yeah,
of course, that's going to go way subgingival. And of course,
yeah,
it just kind of bad leads to worse in some of those
yeah.
cases
That's
like that. So, but, but But anyway, I mean, like I say, I can see a lot of good things on these preps, but it's just one of those things. I don't think you probably, understood all the criteria really super well. So that's kind of what happened. But I think you can do it. It's just that, we're just going to go through the criteria so you know what they are. So, and then this again, we talked about this margin extension 0.5 millimeter above. So we're kind of beating the dead horse here, I think. And of course, this is the criteria for the soft tissue. Again, if there's gross damage to the simulated gingiva,
Yeah,
falls into the deaf category. So, you just want to basically keep away from that simulated tissue there. So
yeah.
now this is your prep on the premolar. And again, not bad. I mean, we got a nice, fairly what I'd say a nice margin here. It's just that it kind of got, maybe
Yeah, it's
under the tissue there. So again, not bad. And it's nice and smooth. All of this is rounded. So I really like it. It's just that, things kind of got too far to the tissue right there. So. And again, kind of on the distal there too, we kind of got, so probably the best advice we can give is kind of try and keep it above the tissue the best we can. And then we'll just kind of gradually, as we kind of prep the tooth, bring it down to that 0.5 millimeter above the tissue. So, but anyway, just some photos I took, and you can kind of see some tissue damage there too. The one thing that I like about this though is that you didn't damage this tooth at all here. So that was actually pretty good. I mean, I don't see any burr marks, because oftentimes you will. Now the one place, let me go back. Let's see, where was it? Right here. This looks good. I don't think you damaged anything there, but there are some burr marks, and even, I don't know, did you, like, it almost looks like you started a prep or something on the lingual of this. So I don't know if that's true or not, but
yeah.
but
I think
this is,
I think I was like I think when I was prep, I was just getting damages too. And then I was trying to polish because I was trying to polish and I accidentally polished that
okay.
too. Then I was trying to polish a lingual. I guess I was just overall nervous because once you
Yeah.
start damage and you try to polish with the
Yep.
stone, and then you start polishing.
Yep. I can understand that. That's,
You try to polish everything and then you just start polishing, it gets really nervous. Once you start panic, it's just
yeah. And the thing is that with these plastic teeth, especially I see it in the operative part with the students, I tell them when they put that composite in, take your time, put it in, don't overfill. Put it to where you want it and cure it, because if you go back in with some type of a polishing thing, these plastic teeth will actually polish away really pretty easily. So I can understand how that could happen. So, but yeah. So anyway, and getting back to where we were, okay. So yeah, okay. This was the occlusal reduction that we had. Now this is that number 5, the premolar. And again, everything looks really pretty good through here. It's probably 1.5 millimeters to 2 millimeters. This was the one downfall that we had just in this spot here. It kind of got over reduced into that 2.5, almost 3 area there, which would probably fall into the sub or def category there. So you just, it was this little swipe there that kind of did it in. So, but the rest of this looks pretty good. It's just that we want to keep this buccal cusp. Again, just kind of a point to remember, this buccal cusp needs to be kind of more up in the air in that area there. So, and again, yeah, here's I just copied and pasted the criteria for the occlusal reduction on this. Again, if we get, where was it, greater than 2.5, then it falls into that def category. So, and again, in real life, that's okay. It's, that's kind of what you want to give the lab, plenty of reduced tooth, so they have plenty to work with. But again, for our criteria, for our testing purposes, we got to put a certain number on it. So it kind of fell below that. And again, here we're looking, this is the molar, that number 3, where it's probably about 2.5 millimeters reduction there. So otherwise, your margin on this looks really nice, looks good. It's just that the occlusal kind of got a little over reduced, and that's probably just because you didn't know the criteria perfectly on it. So, and again, in real life, it'd be fine, but
So is there like a, but you'll show me how to do the depth cut, and then because sometimes if you over polish, you might over reduce. So there's a certain way of how to go about prepping it to prevent over reducing and bringing I can bring the picture, so then I know the criteria.
right. Yep. Make sure you do that. And when you do your depth cuts with your burr, we probably will want to find a burr that's like 1.5 millimeters wide. And we can, yeah. And when we do our depth cuts, like on the occlusal, on the, the buccal and lingual cuts, if we go just that deep, and then we could just kind of connect the dots, or connect the depth cuts, then we should be fine, or at least we should be pretty much in the, in the ballpark there. So we'll practice that, and we'll find a burr that will work for you, and we'll practice that when you're in Topeka.
So that's why I said burr might be important.
Yeah, I can see.
And then if I stay above the gum, then that would, eliminate a lot of problems, not like the real prepping.
Yeah.
I mean, not real human, you go to the gum or below the gum, or
right.
And so then I need to get the burr. So when I go there, I don't need to bring my burr. I don't need to get the burrs. There should be burrs.
I think there's burrs there, aren't there, Mark?
There's burrs, but it would be safe to bring an assortment of burrs with you. So Robin, if you could just give her a general category of what type of burr she'd want. And then Cindy, when you look at burrs, you can look at their diameter basically, and look, like for your axial occlusal reduction, look for ones that are within that 1.5 millimeter type of diameter.
Yeah, I can find a list, or at least I can find you the burrs that we use here at our dental college, and then
email me, and I can see if I can.
Yeah, if you have some of those available, or if you need to order them or whatever. I mean,
we'll have some of those in Topeka. We may not, and you'll be able to see. I mean, we don't have to have the exact burr, but I think we'll get close enough that you'll together find something that you can use. And it's just a matter of being consistent with knowing what you're kind of practicing with and what that diameter is, and then translating that into the day you sit for the exam.
Yeah.
Oh, okay.
And I can, when we're sitting down together, I can do like, if you want me to anyway, do like half a prep or part of a prep and just show you kind of how I
Oh,
would do it.
okay.
And then let you kind of mimic the same on the other parts of the tooth or whatever too. So I'd be happy to do that. Just
Oh,
to
okay,
kind of,
that'll be good.
yeah, just to kind of, help you out, just show you maybe a little bit of a technique,
Uh-huh.
every dentist is going to have their own technique for stuff. So, what I do, maybe not somebody else would do, but I'd be willing just to kind of at least show you the way I would prep it and kind of help you out that way, hopefully. So,
That would be great. And I just need a
mhm.
diagram to always kind of look at it. So
Yeah,
I had to remember
yep. And like I
that would
say,
be.
print out that candidate model or a manual and you can draw your models in it and do whatever. And yeah, just bring it along. And like I say, just, going through that and just diagramming it's probably going to help you remember a lot of it too. So,
Yeah, because sometimes I can study and study, and then when I'm actually there, I actually panic. I usually panic when when there's a
yeah,
lot of students. I actually
And that's common, but you're going to be, I think in this setting, there may be one or two other people in there when you're taking it, and there may not. But it's not big. There's not a big group. It's very, very nice setting, very quiet. I think you'll be, you just collect yourself, take a few deep breaths. It's like anything else, just be prepared and then be confident in your preparedness. And you'll do fine. We all get nervous. So, once you get into it, you'll hopefully lose that nervousness.
yeah,
because I panicked. So it's just a
yeah.
lot. I mean, I guess it's just probably normal for me. It's just
A lot of people do, yeah, kind of get flustered, and we just want you, want you to relax. You're with friends. We're going to try and help you out the best we can. So that's what we want to do. So now this very last PowerPoint, I see we're kind of might be running. I don't know how much time you have,
We're
but
good. We have
this,
about another 20 minutes.
okay. Well, this I was going to say is probably only about a 10-minute thing, and then we can talk about more stuff here. This is actually a PowerPoint that I went through probably a couple of years ago after one of our mock board exams here. We did the same thing. We just have the students practice doing the exam, a month or so ahead of when the actual exam takes place so that they kind of know the flow, they know how to do it, so that when they go in to do it, they actually feel fairly comfortable. So, but anyway, this is, we talked about this, about having your putty matrix seated when you're measuring these things. Again, this is that, 0.5 millimeter from the gingival tissues is where you want your prep to be. And some of these are going to be the same slides as what you saw before. Again, this is that J prep. You don't want that. This looks actually pretty nice there. Now, this is that sloping shoulder. Now, this pertains to that tooth number 9 on the facial margin. We want a shoulder margin, but we don't want it to be sloping, okay? A sloping shoulder is probably more like a chamfer. But whenever you're putting like a all ceramic crown on a prep like this, you want this shoulder margin here, because the tooth is going to flex, the crown, even after it's cemented, it's going to flex a little bit. And with that flexure, you can break off, the porcelain is likely to crack if it doesn't have the shoulder margin. So that's why we want the shoulder margin out here. Okay, does that make sense to you? I mean,
yeah.
I show this to my students because it certainly, then they say, oh, the light bulb goes on in their head. That's why we want this margin, is because we don't want this kind of a chamfer. And now this is okay, like with zirconia or metal, because it's really strong and it's not going to crack or break. But with porcelain, it can crack or break. So that's why you want this shoulder margin. So, and this shows a couple burrs that you probably, I mean, I didn't know that we had photos of burrs, but this is probably what you want to do for your shoulder margin, is have a burr that's kind of a square end, kind of
Square
tapering.
end.
Yeah. Now this is a burr that's more for like your chamfer margin that you want to do on your molar.
Oh, okay.
molar or premolar, and this is more the burr that you'll want to have. It's kind of more squared off at the end that you'll want to have to make the margin on your anterior tooth on your number 9. Now, a lot of times this will be like a millimeter wide. So that will give you that millimeter wide. If you can see where I'm kind of pointing it there, that'll give you that millimeter wide margin that you want for a shoulder. So,
And really on all the preps, you know, that would be the one thing. If it prep varied and went from a shoulder into a sloping shoulder, or even a chamfer in some areas, that could hurt you. You know, if you were fairly consistent, that depth, you know, if the burr is a millimeter in diameter, that you're not going to get hurt too bad in anything. If all of your preps kind of had that type of shoulder on them, all the way around, you know, it would be that would be fairly consistent. It's most important on the anterior prep, but it won't hurt you on the other preps.
that's exactly right, Mark. And I know that when we scan preps here, if we do a crown prep and we scan it and we're going to mill out a crown, say, you know, even a zirconia crown, well, the instructors that help with all the scanning and all that, actually they like these shoulder margins even on molar teeth, just because of that. So it's not going to hurt you. It's just that if you're on that molar tooth on that number 3 and you do a shoulder margin there, it has to be a 0.5 millimeter. But most of the time I tell people just do the chamfer. And these are the 2 main burrs that you're going to want to use for probably the majority of your preps. This one that has that squared off kind of edge to it, and the other that kind of has this tapered kind of a, you know, that's going to create your chamfer margin. So, and you know, various sizes of these, as far as, you know, there's various sizes as far as how much of the diamond burr part of it goes up, how wide this burr is. Like you say, you probably want something that's about 1 millimeter wide, because that gives, it's a really good gauge for, you know, that's how wide you want that shoulder margin to be. So, and on this one here, you probably want a burr that's not real wide, so that when you, especially between that, when you prep between 2 and 3, that your burr is going to be a little, you know, it's not going to be real fat. You're going to be less likely to nick the mesial part of that number 2. So
Oh,
hopefully
Cindy,
that helps.
yeah, Cindy, if you wanted to get kind of an assortment of burrs in that type of category, and then, you know, when bringing them in a little bit of variation, just bring them with you. And then Dr. Hattervig, on the first day when he's working with you, you can get those out right away and he can start to look at them. And then he can give you his opinion of what he thinks would work best. And then, you know, if we needed something else, we have a assortment of burrs in stock. Just I wouldn't count 100% on what we have to be your salvation. I would bring some yourself.
oh, okay. Yeah, I will see if we have the burr, because sometimes I haven't practiced for a long time, like 8 or 9 years, and the practice here, what they use might be different from, you know, the dental school, you know, how they the practice here. So I will see, because sometimes they do all kind of different things, you know.
Okay.
Yeah, probably just some variations of these 2 burrs that you're seeing here is probably what you, like I say, mostly that's what you're going to be using is burrs shaped like that.
Because sometimes the occlusal reduction, they don't use, I don't know what you use for occlusal reduction. The occlusal reduction here, the dentist use, is one of those occlusal reduction burrs.
Right.
Yeah.
It kind of looks like barrel shaped almost.
Yeah.
Yeah.
So
It's wider, thicker in the middle, and then on either edge of it, it's, you know, kind of slopes up. It kind of makes a
yeah.
Mhm.
Yeah.
Right.
So I don't know how, you know, how they use
could-
for occlusal, and they do it really quick, when you
Right.
practice for a long time, they don't do it like dental school. They already know, and they need a lot of space, so they just do
Right.
because they need enough porcelain, otherwise patient fractures,
Yep.
and then
that's-
the lab needs to do the aesthetic. They need enough room for the porcelain. That's why you need extra thickness, or sometimes you need bigger shoulder
Yeah.
for the
You're
stack of
exactly right.
porcelain.
Yeah, that's real
Otherwise,
life. And yeah, in real life, you probably reduce, you're probably reducing the occlusal a lot more than what we are going to be doing here on this exam. So, but you can bring, if you have a couple of those, bring them along. We'll see if it's something you think we can make work. So,
yeah, and sometimes when they have like a deep bite, then you look at their bite, and with a deep bite, they need to do more on the lingual. So it's all
yeah,
variety of cases. So
it depends. A lot of it depends on the occlusion, especially like at number 9. If they have a deep bite, you're going to be reducing quite a bit more on that lingual surface, on that palatal surface of the tooth. So yeah.
so sometimes when I was prep, I get that's why I get all kind of confused. No, but those were really helpful because I want to. My goal is to get the exact criteria and to meet the qualification
Right.
to pass. So I need to know the criteria for for the test. Yeah, it's really helpful.
Good. Yeah, and like this burr here too, you could use that if that's about a millimeter or so. You can do depth cuts on your occlusal from like the lingual and then from the buccal, on these cuspal inclines here, and then just like you say, kind of do that on different spots on the occlusal, and then just kind of smooth it all out, and hopefully you're at that millimeter and a half reduction. So it's something we can practice with too. You can bring some other burrs and we'll just kind of look at them and see if we think they
Okay.
work or not. So yeah. So, and again, a lot of this we've talked about, that line of draw, this gets sometimes tilted. Undercut, again, I kind of talked about this, where I see undercut on this prep is these two areas. There could be undercut there. So kind of watch out for it. This is a nice taper here. This is maybe a little bit too parallel. Again, you can see this is a nice shoulder margin that's about a millimeter wide there. Here, I think we're getting a little bit too wide, but the thing is that, this is what I tell my students, this is probably a millimeter and a half width right here, and it's acceptable. However, if you only have a half a millimeter width on the buccal or lingual, it's a sub. So you're probably better off doing a millimeter to millimeter and a half wide margin than a half a millimeter. Does that make sense to you? If you're going to err, I'd
Yeah.
err on taking a little bit more off than not enough. Okay. So, and of course here we've had we've looked at this before. We want 2 millimeters there, a millimeter there. Here, what happened was that, there's probably a millimeter there, but then it kind of gradually sloped down, and it's almost like this is touching the putty matrix there. And I can understand how that could happen because you're trying to keep this wall at a millimeter and a half high. So if you reduce this down, you're going to, lose some of that wall height, but you don't want to go less than a millimeter on that. So, but anyway, it's kind of what happened in this, and like I say, I can understand how that happens. You just don't want this tooth structure to be touching that putty matrix at that point. So, and here we go. This is not enough reduction on the facial where you're less than a half a millimeter. This is okay. You want to be probably millimeter to millimeter and a half. And then this is too much over here where you're greater than 3. So, and rounded and smooth is what we like. That looks ugly. That's too sharp. So, and then again, we looked at adjacent damage. This is definitely a def. Something like this is probably okay. You don't really want to do too much damage to any adjacent tooth, but in this case here, they're probably okay. That's probably slight damage is acceptable. So, and again, your line of draw, this premolar, it's not lined up straight, kind of tilts to the mesial. And undercut here, we're showing some undercut probably in here. Again, I don't often see undercut from mesial to distal. It's usually from lingual to facial if I do see that. So, and axial wall smoothness, this is pretty rough. This is slightly rough. It's not too bad. Again, acceptable. So, and of course, we looked at all of this before a taper. This is too much here. This is okay there. So. And then again here, this is not enough reduction on that facial. Less than 0.5 millimeter is a def. Whereas if you have 1 millimeter, 1.5 millimeters, you're in that okay range. So that's what I tell my students, make sure you prep it enough. Don't, under prep it, because that'll get you into trouble a lot quicker than if you do a little bit more of an over prep on it. So. Okay.
And that's like that, Cindy, that's the exact kind of note you want to make, is just know your boundaries, know where you don't want to go. Particularly the def, the def automatically knocks you out. So you just want to, just like Dr. Hattervig said, just, try to stay way away from the def, and it's okay to fall into an acceptable area, just play it safe though.
So for, I just want to ask again, so like, it's okay to bring one of these in there to know what is acceptable and what is satisfactory, or I can only bring the diagram that
You just have to bring the diagram that you do. Now you can, you can practice writing the diagrams out on pieces of paper till you get one that you really like. And then,
okay.
Yeah. And then you can basically copy that into your manual.
Okay.
That's what I would do. I would do all 3 preps and just make, little cross-sectional diagrams so you can quickly refer to those. And like
Okay.
Dr. Hattervig said, while you're doing that, you're getting better. You are, at home, you are getting better by just your preparation.
Okay, I'll do that, and then just write down what is acceptable, what is satisfactory. So yeah,
Just even like we did, like these photos right here, if you had that and you had an arrow with 0.5 millimeter to 1 millimeter, that's your key. That's where you want to be. But what you don't want to be is under 0.5 millimeter. If you're under 0.5 millimeter, that knocks you out. So you'd rather be 1 millimeter than, trying to get that exact 0.5 millimeter. That's how I would do it,
okay.
because at 1 millimeter, you can see you're in a good range.
Okay. And above the gum. That's
Right. So really, there's no reason where you would need to get into gingival damage hardly at all. I mean,
yeah.
You should be above that. But like you said, sometimes it's trying to go back in and make something better. You just have to weigh the risk and benefit of that. If it's not exactly what you like, but if you go back and measure it and it's still not at that def range, maybe it's okay to leave that. So that's the main thing you want to do.
Yeah, that's really good tips. I'll keep that in mind, definitely.
And like with our students, when they become seniors or their D4 year, actually that summer before, we have them do these preps 2 different times during the summer, and then we have a mock board exam in usually September, and then we grade it all, and then if they fail, then they have to redo the exam again another time or 2. So by the time they get to the real exam, they've probably done this 4 or 5 times.
Oh wow.
So they're a little bit more, I wouldn't say, probably a little bit less nervous about doing the whole thing because they've done it so many times too. So that's where sometimes I think, you're at a little bit of a disadvantage because you probably haven't practiced it like we do in middle school. So that's why, just like
Yeah.
Dr. Edwards Mark was saying, just diagram things out, by the time they do it 3 or 4 or 5 times, they kind of have it down. So, in your case, just kind of, it's a matter of just getting the pictures of what these preps should look like, getting that kind of that in your mind, where you want to be. So, but
Yeah, this is really helpful. Now I know, just,
yeah,
yeah, acceptable and satisfactory and
right,
stay
right,
above and
yeah,
2 millimeter and 1.5 millimeter,
yeah.
1 millimeter,
All that stuff. It's a lot of numbers to remember, but you can write them down. So
1.5 millimeter on that. Yeah,
yeah,
that number 9.
yeah,
Yeah.
yeah. And with the posterior teeth, this 1.5 millimeters is that very ideal range. Of course, on the incisor on that number 9, it's the 2 millimeter
2
incisor
mil.
reduction that we're looking at. So yeah, it's just a lot of numbers to kind of remember. So, write them down, and in the process of writing things down and diagramming it out, it really, it helps commit that all to memory a little bit better too, I think. So
Yeah, 6 to 16 degree taper. Yeah.
yeah, 6 to 16 degree. Again, I think these are ones that we've already gone over, so I'm not gonna go over all of this again unless you have some questions about it. Again, this looks like really nice prep on that. So your millimeter to or 0.5 millimeter to 1 millimeter, margin width on this it's all good. This one's a SAT, this one's acceptable. This probably got to be about 1 millimeter wide, but again, you want to stay in that SAT to acceptable range on all of these. So, and again, we looked at this before, so nothing new here. Tendency being sharp there, so it just, again, flat anatomy versus, keeping it just keeping some anatomy again. So
And knowing that anatomy is not that important, so I don't have to spend
don't
hour and a half trying to get the anatomy down,
Yeah.
like
don't waste your time on that, because there's other things that you can use your time, it'll be better spent on, rather than trying to make the anatomy perfect on the preps. So, and I see that with my students too. They work on that, and it's like, no, don't worry about that so much. There's some other things that are a little bit more important here. So
yeah, that makes sense. So
Yeah.
because I don't know what's important, what's not important.
Yeah. Yeah. Well, that's kind of my job, is to kind of point that out for you here. So
That's really
yeah. So, and that's the end of that. So, but I don't know if you have any questions about any of these, or
no, this is really good. I mean, I still have a lot of questions which we
Mhm.
can work on, in the real prep.
Right.
Yeah,
Right.
so I can go practice drawing and memorize the numbers and
Right.
Yeah, so
and
maybe kind of in summary, you try to find some burrs that would be like Dr. Hattervig described, and then he will go through those with you. You guys can look at them together, and he can tell you what he thinks might work best. Secondly, when you to kind of go over your schedule, we're doing this on the 12th, so I would arrive in Topeka at the site, the office, maybe about 10 till 8.
okay.
And then we will, and if you got there a little earlier, someone will be there, but we'll start probably right at 8. Okay. And what we
Okay.
just did today really covers quite a bit of ground, gives you some good background. And then you guys will just work independently at your own pace. And we will have snacks and water and lunch. And, we'll try to wrap up at 5 or so. And then Dr. Hattervig he can't tell you whether you take or don't take the exam the next day, but
Okay.
he, like he would a student, he will give you advice.
That would be perfect.
And then,
I appreciate that.
you can process that advice, and we can help you make decisions and things like that. But if all goes well, the next day at 8 a.m., you'll take you know, that part of the exam again. And we have other options, you know, if things happen, but that's kind of the schedule. Okay. So yeah, we'll have water, we'll have snacks, we'll have lunch. And you guys, it's very, very informal, very relaxed environment. As you can tell, Dr. Hattervig has done this a few times. So he's very calming. He'll work with you great. So
Yeah, I
Thank you
kind of
so
enjoy,
much.
I enjoy doing it, and we're on your side, so we want
No,
you
no
to.
problem. I mean, if
Yeah.
I'm ready to take it, I will. If I'm not, I don't mind learning a little bit more because,
Yep.
you know, I need to know the criteria and
Right.
I luckily I have time. I don't mind learning it to make sure I get it down. And this is
Right.
already really helpful. And I'll do my part studying it and I'll take a look
Yeah.
at the birds and
yep, great.
yeah.
Great.
Yep.
And if
Thank
you
you,
have
Dr.
anything, you
Edward.
know, any questions ahead of your visit, just make sure you can just email the central office and they'll pass it on to either one of us. Okay.
Okay,
you-
I appreciate it.
Yeah, or if you want, I'll give you my cell phone number if you have
Yeah,
any
yeah,
questions.
perfect.
It's 1-605
1605
480
480.
0061.
Thank you so much.
So if you run into something, you have a question, just don't hesitate to give me a call. I'm not going to guarantee I'm going to pick up right away. My
Oh, no
medical
problem.
students in the clinic or whatever, just leave a message and I'll try and get back with you. But you know what my advice would be is just, you know, take the rest of the evening off here from this, but then, you know, the next evenings or two or whatever, kind of sit down and take a look at it probably a little bit each night. And then it just kind of reinforces it just a little by little for you too. So don't completely ignore it until until
No,
we
I
get
will.
to
I'll actually study because this is really helpful. Now I know I have a direction to go.
Right.
right.
I really appreciate it, Dr. Hattervig, Dr. Edward. I appreciate it so much.
Okay. Well,
Good.
we'll be here for you, and otherwise we will see you in a little over a week.
Oh, thank you.
Okay.
Look forward to meet you
Okay.
all.
All right.
Thank
Take
you.
care.
Take
Bye-bye.
care.
Bye.
Bye.
All right. Perfect timing.
Okay.
Right at an hour and a half.
Yeah, I guess so.
And-
It is.
And you did really, really well. She felt very comfortable, I could tell. And
Good.
that's explained really well. I think we'll be in really good shape. So
I think she should be able to do it. It's just that she didn't get the criteria or understand them all, I think. So,
yeah. And I think there was a little bit of a language barrier. There was a little bit of, and a lot of nervousness. And you know, it's hard. She hasn't practiced in 9 or 10 years. And,
Mhm.
and it's hard when you're outside the school setting. It's hard to know some of these things.
Mhm.
You cannot readily find advice or information. So I think the goal of this whole deal is basically with some of these people, treating them like they were a student. I mean, you know, giving them that opportunity to improve. Otherwise, how else are they ever going to do it?
Yeah,
I mean,
exactly. I mean, you know, and they talk about going online on YouTube to finding videos, but I don't know if they're necessarily all that helpful. So
no, your personality and everything, I couldn't create a better person. If I could pluck all the good qualities out of different people, you embody all of them. So thank you.
You're too kind when you say that too.
No, it's the truth.
It's
And
I enjoy doing this. So
well, we're fortunate to have you. So I'll go ahead and make sure on our end we have everything ready to go. And then I think you're going to get in the evening of the 11th, and
yeah,
you know your way. If you could arrive maybe about 7:30,
Okay.
that'll be great. And they'll have breakfast at your hotel, but there'll be breakfast there as well.
yeah. Well, I'll
Okay.
take off right after because we're actually doing our mock board exam then, and I'm just going to be kind of a grading examiner, so I can probably head out a little bit early and try and be there, like you say, about 7:30 or so. So
Yeah. Yeah, so we'll be good. And and then hopefully we get you on the road, if you spend the night, whenever you want to leave on the 13th. But
Okay.
just in case, if she needed a little, couple more hours or something, that'd be great.
Yep, that'll work.
All right, Robin, I appreciate it a great deal, and Happy New Year.
Well, Happy New Year to you too. And hopefully you haven't had too much snow there in Colorado.
Now we had about 10 inches the other day, and like when I called you, but we're supposed to get some last night and today, but it was about an inch. So that was great. So no, we're doing great.
Yeah, nothing here in Lincoln except some rain today, but I know back home in South Dakota, they're probably getting that ice and snow and all that.
Yeah, I don't know. I don't like that ice stuff.
Yeah.
All right. Well, have a good evening.
You too. Thanks.
Okay. Take care. Bye-bye.
Bye.